We're so excited you're here for our very first episode. If you've ever been told it's probably just stress, you don't look sick, or felt like truly no one understood what living with a chronic illness is like, you've found your people.
This is a safe space for chronic illness, disability, or anyone that's ever felt invisible or silenced by the system.
This is just your quick disclaimer. We are not medical professionals. Nothing we say should be taken as medical advice. We are simply two people living with a chronic illness who want to have real, honest conversations and to build a supportive community.
So, whether you are curled up in your couch on a flare in your bed or driving to work, this is the podcast for you.
And we're so glad you're here.
Now, let's get into the episode. So, Ava, can you tell everyone a little bit about yourself?
Yes. So I'm from the Midwest. I am 23 years old. I have two dogs and two cats. Goose and Aspen are my dogs, and Luna and Ray are my cats. I recently just got married in October, and we spend 99.9% of our time outside all year round, even though I live where we get very harsh winters.
I definitely feel you there. I'm on the Midwest. It can be rough, but you have to make best of the winters. And what are your diagnoses?
I have endometriosis, adenomyosis, PMDD, anxiety, depression, and ADHD.
Ooh, okay. I have pretty much all the same, much in common.
Yeah.
When did you first realize that something was wrong?
So I got my very first period at the age of 13, and by 14, 15, I realized that something's off. These periods are not normal compared to like what my friends are talking about, and I knew in that moment that someday down the road that something would come up.
Yeah, absolutely. Did you get a diagnosis? What happened? What was your journey like when you went to doctors?
So I started my official diagnosis journey in 2020, and it wasn't until 2025 that I got my first surgery, my first and only surgery. And so I got diagnosed then. Technically diagnosed. They were not able to safely cut anything out, but every doctor has treated me as I have both endometriosis and adenomyosis.
Okay, gotcha. So when you realized that something was off with your first period, you kind of just like brushed it off and didn't really, I'm assuming, want to further explore it.
Yes, I didn't even know endometriosis or adenomyosis existed until my mom happened to come upon it because a lot of women or individuals who are diagnosed with IBS in any format, whether it's C, D, whatever it is, are misdiagnosed and actually have endometriosis.
Yes, yes. It's the tale as old as time. They love the old IBS diagnosis. I'm so glad that she came across
Yep.
an article, but I bet like it was super hard to navigate that growing up and feeling different from everyone else and not understanding why.
Definitely. It was extremely hard.
I'm so glad you were able to make it through, but yeah, I can certainly relate. But I'm glad you made it through and that you're here now and we're able to get the surgery and hopefully some relief from it. Have you been feeling better since your surgery?
Yes and no. We'll have to dive into that later. It helped initially. Symptoms are back, but
Sure.
somewhat better.
Yes, yes. I feel like it's kind of always a double-edged sword of new symptoms but I'm glad that you're doing somewhat better, but also it's never a good
Yes.
thing it's very back. Um,
Right.
so it took 5 years in total for you to actually get the proper diagnosis, right?
Yes.
Or okay, okay. And what's been the hardest part about it for you living with chronic illness?
As most of us know, many things are hard living life with a chronic illness. For me, it is the lack of education and understanding in the medical field and in like my personal life with friends and family on how hard it truly is living with chronic illness.
Definitely. And how does it go when you try to explain it to your friends and family? Do they understand?
They try to understand. but it comes to the unless you experience it yourself, you can't fully understand what it's like.
Yes, absolutely. I think it definitely helps when the people around you try, but yeah, there can definitely be also some fatigue, I think, with trying to over explain to other people
Yeah,
constantly.
exactly that.
What is something that you've learned throughout the journey and what's helped you to kind of stay positive?
Having a huge support system. My husband, he is my rock through all this. I mean, we met as I was starting my diagnosis process, so he's been there with me from the very beginning, and then the community I found on TikTok is amazing. They are always there for you, whether it's via text, Instagram DMs, comments, whatever it is you need, they're there for you.
Yes, I agree. Community is so important, whether it's virtual or in person. And I really think online, it's so incredible how so many of us are brought together. And what do you think is the biggest misconception that you have from other people of living with endometriosis?
Yeah. The endometriosis and adenomyosis is just a bad period. I mean, we see that everywhere. When you see those and you think about the periods, everyone assumes that it's just related to your periods when it can affect literally every single part of your body.
Yes, and especially when we have cases of it being found in babies and stillborn babies, I'm also just sick of people saying that. Yes, it's so far from the truth.
Exactly.
What's your hardest experience that you've had at the doctor, and what did you learn from it, and how were you able to kind of navigate the healthcare system?
I think the hardest part for me was actually trying to find a doctor to listen to me. The first OBGYN that I did see was very dismissive and told me that the only way you can diagnose endo is through surgery and handed me a birth control. So beyond that, I after that appointment, I just gave up for a couple years. I wanted to get through college, and then I moved back home from college and established with the new primary care, and she helped me out tremendously. Still does to this day of getting doctors to listen to me, kind of being a second opinion, and she was also my rock. Was she helped me when I needed it the most.
I think that that makes the biggest difference is when somebody finally listens to you. And were you able to go through an endometriosis specialist, or did you have to go through a general OB?
So he is classified as a general OB, but he has worked multiple endometriosis cases. Personally would not classify him as a specialist. Maybe he does classify himself as a specialist, but my experience alone, he's not an endometriosis specialist.
Yeah, and that can be I'm sure you didn't know necessarily at the time, maybe I'm sure nobody educated you on it, and I feel like there is such a lack of awareness there with patients and providers not properly educating, and then instances of it growing back are
Exactly.
worse.
Yep.
But I'm so glad that you had her along the way, and now do you have the knowledge moving forward if you have to get another surgery, hopefully, to find a better specialist, but it can be so scary and difficult when I can feel like it's a little bit of a dishonest system sometimes.
Yes. So now it's your turn. Tell everybody about yourself.
I'm also from the Midwest. I grew up dancing. I unfortunately had to stop when my endometriosis and EDS both decided to take over, but I did jazz, tap, ballet, lyrical. I loved it so much. I also did spend a lot of time outside, and I still do as an adult, but I'm a little bit less brave than you and tend to stay inside during the winters. But I love having the seasons change, so I can't have any complaints there. And I also
Yes.
have 2
I
tuxedo
love
kitties.
oh, I love that. I have a cat, she has socks.
I love mine both have socks too.
Um, when did you first realize something was not right?
So I started to experience symptoms as a baby, and it started with really severe constipation problems. And instead of crying when I was in pain, I would always say the words poo poo. So my parents knew that something was wrong and they took me to the doctor, but they told my parents just to give me more fiber. The fiber didn't really do anything. I continued to have bowel issues. And then into my early childhood, I was just always complaining of stomach aches and throwing up, and the bowel issues just continued to get worse. And then the day before my first period, I started to get really bad stomach pains. And then the next day, I got my period, and I realized that the stomach aches that I had been experiencing for years on end were actually a lesser version of the cramps that I got on my period. So it was a really interesting t turn of events, if you will,
Yeah.
when I realized that that was what was going on the entire time, because I also started to experience really severe bowel issues while I was on my period, and it all just kind of started to get worse, and the vomiting, constipation, everything just amplified. So, we went to a few doctors and nobody could really figure out what was wrong. And then 6 months later, I had my first endometrioma rupture, and I went to a hospital, and a provider who was a male asked to do a pelvic exam on me after they had already established that the cyst had ruptured and there was no need to do a pelvic exam. So I'm very grateful that my dad said no, but I definitely look back at that and question why they would even suggest that for a 13-year-old. But after that visit, I went to an OB, and there were 2 providers in the room, and both of them sat me down and told me that I had endometriosis. But they just put me on continuous birth control, and then I was bleeding for 5 years straight, and nothing would help. But I was also vomiting and still having the bowel issues, and I didn't understand that that was caused by the endometriosis because I tried to research it and look into it, but the only article I could come across was that it was caused by retrograde menstruation, which we know, obviously, now it's not true. And I also came across the study of the attractiveness of women with endometriosis, which, as much as that's kind of become a funny thing on TikTok, I think coming across that when you're 13 and trying to figure out what's going on with your body was a really pivotal moment of just being realizing that doctors also put more value on our looks than our bodies, and it just was, yeah, a sad moment as a young
Yes.
girl to just sit there and realize that that was what was being studied when I was in debilitating pain and missing school and wasn't able to do things with my friends or family.
Yeah.
And it's still
I
really
remember seeing that for the first time.
it's a crazy study. It's like
Yeah.
that one, and then even more recently, very recently, they did the one on how endometriosis affects male partners, which I'm sure you've seen as well. But anyways,
Uh,
that's how I started to become really interested in science and the research side of endo because, I mean, I think when you're living with something and wanna know what's going on with your body, you wanna research it and understand it better. So, if I wasn't going to school, I was, might as well look for scientific articles. And there was so little info out there, but I feel like even in the past 10 years, not much has changed. We still don't have the information we need.
nope.
And
Um,
it's crazy.
yes, it is. What diagnoses do you all have?
Endometriosis, adenomyosis, PMDD, ADHD, PCOS is a possibility. It came back positive on the blood work, but it's something that hasn't really been further confirmed. I've always suspected it because I've always felt cyst rupture and have always seen cyst on ultrasounds, but it's not 100% confirmed. More speculation on that one. And I also have
Okay.
EDS.
Okay. What is the hardest part of living with a chronic illness?
I would say having to change your dreams and future so often because, as we know, nothing is ever predictable. And for me, I've had 5 surgeries in the past 5 years. So it's really caused things to shift around for me. I expected that I'd be graduated by now, but instead I am recovering from a hysterectomy. But I am on my way to getting a human bio degree. The reason that I've had 5 surgeries is because in 2023, I had a surgeon who claimed to be an endometriosis excision specialist, and he went through and I don't know exactly what he did to this day. I believe he ablated through my organs, and it took me 3 years to get all of my paperwork back. But I was rushed to the emergency room the same night as my surgery because I had been home for about 4 hours and I was bleeding through pads in, like, 15 minutes on average, and I couldn't move my head in bed without vomiting, and I looked out at my incisions and they were bleeding. So, at that point, I figured I was likely internally bleeding, and when the ambulance came, they took me to the hospital. At the hospital, my hemoglobin was at 6.9. And then I had to get a CT scan, and the CT scan showed that there was a liter of blood in my abdomen. So I had to get an emergency blood transfusion and an emergency surgery. And the surgeon who did the emergency surgery told me he couldn't even find the source of the bleeding, and that he said I definitely wouldn't have made it until morning if I didn't come in when I did. So after that, naturally, I called the surgeon who did that to me and I asked what had happened, and his only response was that these things happen sometimes. And then he hung up the phone on me, and I kept asking for the documents back, and it took 2.5 years. And I finally got them back a few months ago. And reading through them was so horrific. It showed that he scraped cervical mucus. The type of anesthesia that he put was called general endo, which that of course isn't a real type of anesthesia. He also did a DNC on me, and there were just so many things that I learned when going through those documents, and I was absolutely horrified, and when I looked back at the photos, I could see all of the blood that was already pooling during the surgery, and I absolutely should have been sent to the hospital or admitted, and I wasn't at that time, which was really disheartening to learn and to learn that it was to that severity and he knew it was to that level but still sent me home. It was definitely shocking, and then the worst part was a month after that surgery, I got an MRI and it already showed that I had deep infiltrating endo, which confirmed my worst fear, which was that nothing was removed. And I still have no idea what happened during that surgery.
That is crazy.
It really
And the
is.
unfortunate thing, you are not alone in crazy surgery stories.
No, I know. It happens way too often with endometriosis care, especially. And I
Yep.
think because we have such a breach of what actually qualifies as an endometriosis specialist, there's a huge issue with that when we don't have any actual laws put into place on what qualifies a specialist as a specialist.
Exactly. And it will continue to happen until there's guidelines for that.
I know, and we need them so badly because I almost died and women have died because of it, so it's
Yep.
just it's horrific. I'm happy to be here to tell the story, but I just always want to use that to encourage people to vet their surgeons like crazy and really do your research before you allow anyone to operate on you.
1,000%. And I know that is shared widely in this community is you need to do your research on your surgeons. Yes,
Yes.
wild things can randomly happen, and we all understand that, but comes back to the how much of a specialist are they? Are they really a specialist? And you have to pay attention to that.
Yes. So important.
What is something that has helped you cope with having multiple chronic illnesses?
I think understanding the diseases better. has helped me to understand, along with, as you said, community and surrounding yourself with people who understand and want to be there for you.
Yes. And lastly, what is one thing you think people most misunderstand when it comes to your conditions?
I would say similar to as you what you said is that people assume it's a period disease when it's absolutely not that. And I think that that's a common misconception that a lot of people with endometriosis deal with. And I would say more than that, since getting my hysterectomy, it's just added to that frustration of people assuming because I have a hysterectomy, I'm all of a sudden cured. But as we all know, that only cures the adenomyosis part of it. And if it were that simple, we wouldn't have millions of women still dealing with it.
Exactly.
Well, that wraps up our first episode of Chronic Not Crazy. And we hope that this helps everyone to feel less alone in their journeys.
Yes. And we're just getting started. In future episodes, we'll be diving into topics like navigating the healthcare system, medical gaslighting, relationships, mental health, and so much more.
We will also be welcoming guests, other people living with the same conditions, different conditions, doctors, researchers, etc.
And we'd love for this podcast to be a community. If there are any topics you'd like us to touch on, or if there's someone you'd love to see on our podcast, let us know.
And we will be releasing episodes every other week, so be sure to tune in on wherever you listen to your podcasts.
Thank you for listening, and we'll see you in 2 weeks for another episode of Chronic Not Crazy.
Bye.
Bye.